So, did you know that osteoarthritis is the most common form of arthritis? Very common. And because we're dealing with the senior population at SCAN, we see an awful lot of it just coming in and out of the office every day at SCAN. So, we're going to talk about that today. So, if you want to know a little bit more about osteoarthritis, stay tuned. Hey, good morning, everyone, and welcome to SCAN FYI. Yeah, today is about osteoarthritis, which is unfortunately an all too common affliction of an awful lot of people. So my guest today is Nolan Horowitz. Nolan, thanks for being with me today.
No problem.
So why don't you tell everyone a little bit about who you are? You're from Atlantic Physical Therapy. Why don't you tell a little bit about yourself and what is your role at Atlantic Physical Therapy before we get into this whole topic?
Sure. Well, thank you for the introduction. As you said, my name is Nolan Horowitz. I'm a physical therapist. I've been practicing about 10 years now. I graduated from Seton Hall in 2013. I am now currently with Atlantic Physical Therapy in Middletown, and I'm the clinical director. We opened up the office in November, and I've been working with Atlantic since about March. And we're just growing our patient population. When I came on, we were seeing about 20 visits a week. Now we're kind of in that 50 to 60 visit range, which is great. We've been out in the community kind of doing some events, which is where I met you at the Monmouth Mall, doing a senior fair. But we're also active in the community doing some 5K races and just kind of getting our name out there and marketing with different doctors. I have a couple good physician relationships within Middletown as well. So if you ever need any recommendations, I have a few doctors that I have in my pocket. But today we're going to talk about osteoarthritis. And as we were speaking, I think we agreed this was a pretty good topic because, as we know, as we get older and as we wear and tear our bodies, we do develop this condition. And so I just wanted to kind of educate, the people listening and just kind of have a conversation about it and let you know what our role is in physical therapy and how we can kind of manage it and, help you at home manage it and modify your lifestyle so that we don't, in the end up with a surgery.
Right, exactly. Well, first, let me just tell everyone that, of course, all the information, the contact info for Nolan and Atlantic Physical Therapy, as usual, it will be in the comments and in the description. So don't worry about that. You'll be able to reach out if you need him. But first of all, Nolan, for those who are listening and maybe I've heard the term osteoarthritis. Can you give us a good definition of what it is?
Sure. It's essentially just a degenerative joint disease. And what that means is that there is cartilage on our bones that kind of wear and tear, if you want to call in layman's term, that kind of just over time just degenerates. And it can become painful and you get some stiffness, swelling. And it really is something that inhibits some of the things that you like to do within your lifestyle. Unfortunately, like we said, it just happens with. I'll talk about some risk factors and predispositions, but unfortunately, as we do get older, it's a cause of our body kind of breaking down, and that cartilage is not kind of regenerate. So we have to figure out ways how we're going to manage it and improve our quality of life and our function so that we can do the things that we like to do. So I'm going to kind of explain what the cartilage is and what the function is, and then after that, we can talk about like the causes and the risk factors.
Well, I feel like anyone who's aging and is using their body and doing things and moving and doing around, it almost feels like it's inevitable. And, at SCAN, obviously, everyone is a senior. And I mean, I feel like rarely do you meet someone who, isn't facing this. Right. And part of me thinks that, well, if you don't have osteoarthritis, maybe you've been a couch potato for far too long.
Yeah, you could think of it like that. Yeah. There are other factors, though. I mean, there is genetic factors going on there. And sometimes there's no rhyme or reason. Our body just kind of develops it. There is also rheumatoid arthritis, which we won't get into today, but that's like an autoimmune condition where a body does break down that cartilage and causes inflammation. So even if you are sedentary, you still can develop it. But it's a good way to look at it. I never really thought about that.
So
So
what are some of the risk factors that
yeah.
would be associated that kind of mean you're probably going to get
Yeah,
this?
yeah, absolutely. So a big one that we see is actually obesity. The more weight that you kind of have on you, the more load you're going to have on your joints. So
Right.
if you are obese, even just kind of walking around, that's a lot more force from the ground and your body weight on those joints. And then, like I said, over time, it kind of just breaks down that cartilage. And you may not be symptomatic, right away, but over time and over years, then you start to get some of that swelling and stiffness and pain, and it's not fun. So I do educate a lot of my patients if I do sense there is obesity or we know there's obesity, that weight management can definitely play a role and help you as well.
Especially in your knees, right?
Absolutely, that's
That's
the
really
main point.
where it's
Yeah,
really going to get you. Because in your
absolutely,
knee, your legs are supporting your body. Your knees do a lot of work, guys. They really do.
absolutely.
Your
Um,
knees
and
and your ankles, they're holding you up.
Exactly. That's usually the most common joint that we see with the arthritis because, like you said, you're holding your body weight up, and it's just a lot of load to that joint that typically shouldn't be stressed, right? But so another thing that we'll get into, but we focus on strength, right? So if we can improve our quadriceps, since we're talking specifically about the knee, that will help absorb some of that body weight and some of that ground reaction force to kind of absorb it through the body so it doesn't go right to the joint. So really focus on some strength training, controlled strength training will be beneficial as well.
So what are some signs and symptoms if someone suspects, well, I'm having some issues, what do they really need to look for? Before so once you know what to look for, then you know what to do about it.
Absolutely. If you get a lot of stiffness in that knee, like let's say you're sitting down, you're going to stand up, and you're just like, oh, that knee just doesn't want to move, or it's kind of grinding,
Sound
that,
familiar out there? Yeah.
that's usually a sign that there's some degenerative changes going on, specifically for the knee, what we're talking about now. Inflammation, that's another common sign that we'll see. That joint can get really irritated and inflamed, and then it becomes painful to even move. Lack of flexibility, that joint mobility, as I mentioned, kind of that grinding. If you get that kind of, we call it crepitus, which is that grinding on that bone. That's
I
not a
know that sound. I bet a lot of people know that sound. It's a
yeah,
horrible sound. Yeah.
absolutely. So those are the big things that we see: inflammation, pain, swelling, stiffness, lack of flexibility. You can even get weakness because we know whenever there's some inflammation or swelling inside the joint, some of our muscles get inhibited, and then they don't generate that strength that we typically need to function and move. So we do see a lot of weakness in our muscles, specifically the quadriceps for the knee.
Nolan, just to be clear to people, so if you go to a movie or you see a show and you're sitting for multiple hours and you get up and you're feeling a little stiff, that's not and that's going to go away in a little bit. So we're not talking about that.
Yeah,
I
absolutely. I
want to
mean,
make sure people understand.
absolutely.
Everybody has that.
I,
Okay.
I always say motion is lotion, right? So
There. Oh yeah, me too. Me too. I
if we're
love that.
if we're sitting, yeah, of course, over time you're going to have that stiffness those first couple movements. But once you get moving, the body should start getting the blood flowing. There's some nutrition in that cartilage, and there's some lubrication in that joint that allows that smooth motion. If after a period of time and we're moving and you're still feeling that stiffness or it's just not loosening up, then I would say, all right, hey, there might be some signs of arthritis there. But those first movements, no, I mean, everybody's going to get stiff without motion in the beginning.
I don't want everyone running out and say, "Oh my God, that happens," or you sit in the car for a long time.
Right,
That's not
right,
what we're talking about.
right.
Beside your knees, which is so common, where else are people experiencing osteoarthritis?
Yep.
And what other joints
We
are
see
common?
we see it a lot in the hips. The knees, hips, and spine are probably the most common. Knees being the most common, but definitely hip. It's another weight bearing joint. And the spine. I mean, that spine's getting loaded with gravity and even our body weight. So, there are some cartilage in each individual segment. So that can happen as well. But most commonly, like you said earlier, those knees bear most of our weight. So that's typically where we'll see it.
All right, so we have an issue, and so we need to make sure it's diagnosed. So what do people need to do?
Yeah. So if you're feeling, those kind of signs and symptoms that I mentioned, The really only way to diagnose it would be through an X-ray, because that will really give us an idea, or the doctor an idea of how close those joint surfaces are, and if there is some cartilage still present. If that's bone on bone, then we know that's pretty severe arthritis, and some management needs to be, or treatment needs to be done. But there are severities of it. You know, you could have a mild case of it, and the doctor may say, hey, you know what, you're not in much pain, you're still pretty functional, keep doing what you do. We'll revisit this in a few years. You know, get as much as you can out of this. But again, physical therapy will definitely help you manage that, and even modify some of the things, which we'll talk about in a little bit. Activity modification is huge if you want to continue to do the things you like to do and prolong the life of the joint.
Going back to what you said, motion is lotion. Yeah. I say that all the time. So it's nice to hear you say it. Yeah. You know, so if you're experiencing some symptoms, and you know, for some people, their first thought is, "Oh, I can't walk. I don't want to do this. I don't want to do that." But isn't it really? It's the opposite. Absolutely. You need to get your body out and move.
We see a lot because of individuals who don't move because of the pain, right? They go to move and like, it's so painful. I can't do this. I can't do that. But there are exercises or things that we can do to get the body moving in a controlled fashion. So absolutely, I think, you know, movement is key. If we're not moving, you're just going to get stiffer and stiffer over time. So we really need to make sure that we are moving, and again, in a controlled fashion, low impact, or just through a passive range of motion where we're just getting that joint moving without loading it. Is important, and that would be something that your physical therapist can work with you, teach you some exercises or techniques to kind of address that.
So I feel like for some people, they're at a loss, like, what should I do? What is the right exercise? What is the wrong exercise? Right. And for someone like that, I would say, well, the easy solution might be to speak to your doctor or to go to a physical therapist, which now we can just go to.
Absolutely. So let me bring up a quick point. We do offer direct access, which is where you can come see a physical therapist. If, let's say, you're having some pain and you kind of have a sense that it is arthritis or whatever, and you don't want to go to the doctor, you want to kind of cut that out, so to speak. You can come to a physical therapist. We can evaluate you, treat you for 30 days. After that 30 days, then we'll need you to see a doctor to get a physician script on file. But typically, in my experience, within that 30 days, I can teach you a whole lot of things you can do at home and manage it. You feel pretty better. So, I mean, if you do that and you feel better, then there's no need to kind of go to the doctor. So we do offer that. I will say, though, Medicare does not cover it. Every other private insurance.
Shame on you, Medicare. Shame on you.
So we will need a doctor's prescription. The good thing is and as I mentioned earlier, I do have some relationship with doctors. So sometimes it's a simple phone call and saying, hey, I have a patient who I think is arthritic. I want to help them imagine. Can I get them an appointment with you just to kind of get a script? And more times than not, they'll get them in as soon as possible, or they'll write them a script. So it's not a hard process, but unfortunately, Medicare does not cover that, and you will need a physician's script on file.
Right, but you know what? That's easy enough to do.
Yeah, exactly. That's it. And like I said, recommendation. So you can call me, and I can help you out.
The thing that my feeling about it is, nobody wants surgery, and I know the option is always out there. You get a new knee. I mean, all that nonsense. It's not nonsense. All that, yeah. But that's your last resort. Why wouldn't you do a little, do some exercise, move around, take a walk? You know, Absolutely. Just walk. Absolutely. And anything to make yourself feel better, you know, because we work with seniors too, and we hear it all the time. Oh, I'm so sore. I couldn't walk. I couldn't do this. But even walking, honestly, right, for 5 minutes a day.
Better than nothing. Absolutely.
I know we're not telling people that you need to do a full-on aerobic workout. What would be just some basic things that you maybe could just do every day at home?
Absolutely. So I'm a big advocate of aquatic therapy. If you have a pool, get in that pool, because you can walk, you could do some exercise. Just moving in that pool is great, and you're not getting the effects of gravity or your body weight. So your joints are not getting stretched. You can walk up and down that pool and move, and you feel good after that too. I've had a lot of patients in my experience that aquatic therapy actually made the biggest difference as far as just improving their activity level, improving their quality of life. I'm also a big advocate of a bicycle, or a common bike. Yeah,
Yeah.
low impact. Exactly. You're not really stressing that joint. You're going through the motion. You're getting that knee moving. Very, very good thing to do as well. I don't like treadmills. I think that's kind of an impact activity. So I never really tell my patients to do that. But if you do have one and that's all you have, like you said, 5 minutes shouldn't harm you. But I would think of other lower impact activities that you can do. And like I said, aquatic therapy and a bicycle are the best things that I tell my patients.
So what about even just taking a walk?
Yeah, absolutely.
I mean, we're not talking about, power. We're, a nice gentle walk,
Yep.
moving your body.
Now there are different terrains out there if you're walking on gravel
Yes.
versus a soft
Yes.
surface, so you just want to be careful of that. Hills, you do want to be careful of all that. But like you said, it doesn't have to be, a mile, 2 miles. Just get out there, walk around your block once a day, twice a day, whatever it is, just to get out and moving. And I'll tell you what, you also feel better in your mind. You get the endorphins flowing. There's nothing worse than just sitting there and being in pain and not knowing what to do or not being able to do it because of the pain. So there are things you can do. You have to be motivated, and you have to be educated as well. And hopefully this is why we're doing this, so we can educate the people listening. And like I said, if you ever have any questions or concerns or unsure, you can always call my office. You can call a physical therapist. They're more than happy to help you and give you some recommendations.
So Nolan, what would be some lifestyle changes that we could make so that, all right, we acknowledge now we've got osteoarthritis. What are some things we need to do in our life to just, manage our symptoms to make ourselves more comfortable on a daily basis?
Yeah. I mean, there are medications. I don't like to tell my patients to be reliant on them, but they do control some of the symptoms. So any anti-inflammatories or NSAIDs, which we call non-steroid anti-inflammatories, even some topical creams or sprays can help you with the pain. Then as you're going down the road, if you do see a doctor, typically they'll do some injections, and we call it a gel injection, where it just kind of lubricates that joint and gives you a little smoother motion. So those are things you can think about. But other activity modifications are, if you feel like you need a brace or an assistive device, I don't like to promote that too often, but if it's necessary, it will help you. It'll give you more support if you wear a knee brace, if you're going for that walk, or even having a cane or some type of assistive device just to help you. And then I talked about just low impact activities. So I'll give you a quick example. My mother, she's 70 years old. She played tennis her whole life and was a skier and just very active hiker. And she has arthritis. She is doing great right now, and she just modified playing pickleball now, which is a huge thing I know in the senior
Yes,
population.
it is. Yes, it
But
is.
she's playing pickleball instead of tennis. She is going in the pool, doing more swimming. Unfortunately, she's not skiing anymore, but she was only going a couple times a year, so she kind of said, "I'll throw that out the door." But you have to think about what you do, and then, all right, is this too much? What do I need to cut out, or what can I back off a little bit and modify? Like I said, pickleball is a great option for tennis if you're big into tennis, and I know that's a huge thing nowadays. So you just have to think what's important to you, what do you like to do, and then how can you minimize the impact on our joints by kind of decreasing that load and decreasing that or giving yourself more low impact rather than high impact.
I always like people to put a positive spin on things and not focus on, oh, I can't do this, I can't do that.
Absolutely.
I like to focus on, well, I can do this, I can do this. Oh, here's a good option for me.
Yep.
So, you got to trick your mind a little bit too. And
there's a mind game as well. Yes. I know, you're in pain. I know you may not want to do it, but if you can just get that little bit of motivation, I promise you'll feel better if you just get up and moving and try to help yourself. It'll go a long way.
Motion is lotion. See,
look at that.
I'm not the only one who said it's nice to
use it. I use it all the time.
It's really, it becomes, I feel like, a self-fulfilling prophecy. If you say, oh, I'm in pain, I can't do this, I can't do that, and you just stay still, well, then it just gets more and more difficult to start moving. But Absolutely. If you, a little bit every day, I feel like it makes such a big difference. And if all you can do is 5 minutes today, well, maybe by next week you can do 10 minutes. So come on, guys. do it. You can do this.
Absolutely. The other thing that I do with my patients is we set goals. So, what do you want to get out of this? What do you like to do? All right. Well, I want to go for my walk, but I've been in so much pain I can't do it. I can't go for my mile walk. All right. So let's start with a quarter mile walk, or let's start with whatever, and we'll work our way to get you to that goal. So setting goals is huge. If you don't have goals, then you don't really know what your end game is, So we have
That's true. That's true. Yeah.
So.
All right. Well, I hope this was really helpful for everyone. You learned something about osteoarthritis. It is something that can be managed and treated. And maybe seeing a physical therapist is a good place to start just for an evaluation. Yep. And you see where you are. But remember, I'm gonna put it on the screen too, like motion is lotion. Get out there and move. And you know what else comes with all this additional exercises? You know what? You're going to sleep better at night.
That's
right?
True. That is very true. Yes.
Yeah. You're definitely going to sleep. You're going to feel it. You're going to notice it. Well, yeah. Nolan, thank you so much for being with me today.
No problem. I appreciate the invite. This was a pleasure. And hopefully, like you said, we educated a few people, and hopefully they can start to feel better about themselves and make changes.
Well, remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone, and bye, Nolan.
Thank you. Have a good day.